Most people over 70 are only using a fraction of their lung capacity, leaving vital air sacs dormant and causing that heavy morning congestion. But what if you could restore your respiratory health before even getting out of bed? This simple, rhythmic nasal technique bypasses chest tension to flood your system with oxygen in minutes, and it requires no equipment, no gym, and no physical exertion whatsoever. Think about the last time getting up felt harder than it should. You take your first breath when the alarm goes off, but the air does not seem to reach far enough. You sit on the edge of the bed and your chest feels heavy, like the morning has not quite opened yet. You walk to the bathroom and find yourself slightly winded from something that used to feel effortless. You tell yourself it is just age, but here is what almost nobody explains. That feeling is not simply age. It is something specific happening inside your lungs that has been quietly developing for years, and it responds directly to the right kind of breathing technique, performed at the right time of day. I am Dr. Natalie Brooks, and across more than 30 years working in respiratory medicine and senior health, I have seen this pattern repeat itself with remarkable consistency. Adults over 70 who feel breathless doing things they used to do without thinking. Adults who wake up foggy and tight in the chest, who assume nothing can be done. And adults who, once shown a single bedside breathing sequence, begin to feel a real difference within the first week. Not from medication, not from a breathing machine, from understanding how their lungs actually age and what to do about it. Here is the part most people have never been told. You were probably advised to stay active and walk regularly. And walking genuinely benefits your heart, your joints, and your circulation. But walking alone does not retrain a weakening breathing muscle. It does not reopen the dormant air pockets that collect stale air at the base of your lungs. And it does not correct the shallow chest breathing habit that most people over 70 have unknowingly developed over decades. That is not a fault. It is what incomplete advice leaves behind. Before I share the technique, drop your age and where you are watching from in the comments right now. I read every single one. Now let us talk about what is actually happening inside your lungs after 70, because understanding the problem is what makes the solution make sense. The main breathing muscle in your body is not in your chest. It is a large, dome-shaped muscle sitting just below your lungs, called the diaphragm, and it is responsible for around 80% of every breath you take. With age, this muscle gradually weakens and loses its full range of movement. At the same time, the rib cage stiffens, making full expansion harder. Research published in the European Respiratory Journal found that these combined changes can reduce how much air your lungs can move by up to 30% between your 30s and your 70s. A study published in the Annals of Cardiopulmonary Rehabilitation confirmed that after the age of 70, the annual rate of this lung function decline actually accelerates. Doctors call the condition that results from weakened breathing muscles respiratory sarcopenia. And just like the gradual muscle loss in your legs and arms, it is measurable, it is progressive, and with the right practice, it can be meaningfully reversed. Here is what makes this especially important to understand. As the diaphragm weakens, something subtle shifts in how you breathe without you ever consciously deciding to change. The shoulders begin to rise slightly with each breath. The belly pulls inward. Only the upper portion of the lungs fills with fresh air on each breath in. The lower section, where the greatest volume of lung tissue lives, gradually receives less and less participation. Over time, the air pockets in those lower areas become dormant, holding on to stale air that is never fully cleared between breaths. This stale air is higher in carbon dioxide and lower in the fresh oxygen the blood needs. When fresh air mixes with it on each new breath, the quality of what reaches the bloodstream on every inhale is reduced. This creates the dense, heavy, congested feeling in the chest that so many people over 70 describe waking up with every single morning. It is not infection. It is not disease. It is an engineering problem with a clear and practical solution waiting on the other side of this video. The bedside breathing breakthrough I am going to share today is a modified version of the 4-7-8 rhythmic technique, adapted specifically for the physiology of adults over 70. The original technique, developed to slow breathing and activate the body's calming response, involves breathing in for 4 seconds, holding the breath for 7 seconds, and breathing out for 8 seconds. For seniors, the 7-second hold is shortened for safety, particularly for anyone managing blood pressure concerns. But the core principle behind the technique is powerfully supported by research. A 2022 study published in Physiological Reports investigated the immediate effects of this rhythmic breathing method on the nervous system and blood pressure. Participants performed 6 cycles of the technique for 3 sets, with 1 minute of normal breathing between each set. The researchers found significant improvements in heart rate regulation and meaningful reductions in systolic blood pressure, and they identified the extended exhale as the key mechanism, because a long, slow breath out activates the body's rest and digest response through the vagus nerve, the same nerve that tells the heart to slow down and tells the mind to release its grip on the stress it has been holding since the night before. A separate 2023 study of older adults, published in a peer-reviewed journal, found that slow, deep breathing practiced before daily activity significantly improved attention, working memory, and mental clarity, both immediately and 24 hours later. The morning brain fog that so many seniors describe is not simply tiredness. It is partly the nervous system still holding its nighttime tension, and slow rhythmic breathing is one of the most direct tools available for releasing it. Here is how to perform the bedside technique safely. Remain lying flat on your back before you rise, either still in bed or on a firm surface. The flat position is deliberate and important. When you are lying down, gravity helps the large breathing muscle sitting beneath your lungs move through a larger range of motion than it can achieve when you are sitting upright or standing. This means the lower parts of the lungs, the areas most prone to dormant air accumulation, are far easier to reach and clear when the technique is performed in this position. This is the specific reason performing this at the bedside before rising for the day produces noticeably better results than trying the same technique later while seated at a table or standing in the kitchen. Place one hand on your chest and one hand on your belly just below the navel. Let your shoulders relax and drop. Now, breathe in slowly and quietly through your nose for a count of 4 seconds. As you breathe in, the hand on your belly should rise, while the hand on your chest stays as still as possible. That rising belly confirms the diaphragm is moving correctly, pulling air down into the lower lobes rather than letting the chest and shoulders do the work. Hold your breath gently for a count of 5 seconds. Then release a slow, complete breath out through slightly parted lips for a count of 8 seconds. At the very end of the exhale, allow the belly muscles to gently contract to press out the last remaining stale air before the next breath begins. That final clearing is what makes room for fully fresh air on the next breath in. Repeat this 4-count in, 5-count hold, 8-count out sequence for 4 complete cycles. Then rest and allow your breathing to return to its natural rhythm. 4 cycles takes approximately 3 minutes. This entire practice happens before you sit up, before you check your phone, before the day begins. For anyone with COPD, asthma, or known blood pressure concerns, remove the 5-second hold and simply practice the 4-second inhale followed by the 8-second exhale, which delivers the same primary benefit without the breath hold component. The immediate effects of this technique on the body are real and relatively quick to notice. Within the first 2 to 3 minutes of consistent practice, the extended exhale begins activating the body's natural calming response, shifting the nervous system out of the tense, elevated state it holds through the night and into the calm, alert state that supports comfortable waking hours. Blood pressure tends to drop slightly within the first few sessions of consistent practice. The dense chest congestion that typically accompanies the first hour of the morning gradually becomes lighter, and the mental fog that usually takes the first cup of coffee to shift begins to clear earlier, because the brain is receiving better oxygenated blood before the person has even placed their feet on the floor. For many people, the first noticeable sign that the technique is working is not a dramatic change in breathing. It is waking up and realizing, sometime around the end of the first week, that the morning simply feels different, lighter, clearer, a little more ready. A 2022 randomized clinical trial studying institutionalized older adults with a mean age in the early 70s found that diaphragmatic breathing practiced 3 sessions per week for 8 weeks produced significant improvements in lung function measures and blood oxygen levels. Not medication, not equipment, just deliberate, consistent breathing practice at the right time and in the right position. The long-term benefits of building this as a daily habit extend well beyond morning comfort. When the breathing muscles are asked to work through their full range every day, they maintain their strength the way any other muscle in the body does when it is used consistently and deliberately. Research published in the Journal of Physical Therapy Science confirms that respiratory muscle training increases the thickness and functional strength of the diaphragm over time, and that this improvement carries forward into reduced breathlessness during physical activity. The small muscles between the ribs, which control how fully the chest wall can expand, also become gradually more flexible when the breathing practice includes a full-range expansion breath, meaning that each week of consistent practice slightly increases the total space the lungs have to work with. A 2024 systematic review published in the Journal of Clinical Medicine on breathing rehabilitation in older adults found that consistent respiratory muscle training improved diaphragm thickness and chest expansion directly, with those improvements translating into measurably reduced breathlessness during daily activities, including walking, climbing stairs, and carrying loads. Perhaps most surprisingly to many people, the same study found meaningful connections between better daily breathing practice and improved nighttime sleep quality. When the body enters sleep with a calm and well-regulated nervous system, the depth of sleep improves, nighttime awakenings reduce, and morning respiratory distress, the kind caused by shallow breathing throughout the night, decreases significantly. That means the 3 minutes invested each morning compounds into benefits that reach hours into the night. The simplest way to integrate this habit safely is with a 3-minute morning session before rising and a 2-minute evening session before sleep. Morning. lying flat, 4 cycles of the 4 count in, 5 count hold, 8 count out as described. Evening, seated comfortably in bed, 4 slow belly breaths in for 4 seconds and out for 6, followed by 2 of the rhythmic cycles to settle the nervous system before sleeping. No equipment, no mat, no special clothing, just your breath and a willingness to give it 3 consistent minutes before the day begins. For anyone managing a diagnosed lung condition such as COPD or asthma, the modification is straightforward. Remove the breath hold entirely. Practice the inhale and the extended exhale only. If any technique causes dizziness, shortness of breath that feels unusual, or discomfort in the chest, stop and return to normal breathing. These techniques are designed to feel gentle and calming, not strenuous. If anything feels like effort or strain, that is a signal to ease further back, not to push through. One way to track real progress without any measuring device is to pay attention to how many steps you can walk at a comfortable pace before needing to pause and catch your breath. Most people find this number increases meaningfully after 4 to 6 weeks of consistent daily practice, not because their lungs have become younger, but because the main breathing muscle is working more efficiently. The lower air pockets are staying active and exchanging fresh air with each breath, and the nervous system is no longer spending the first hours of the morning in an elevated tension state that makes every breath a little more work than it should be. When breathing becomes more efficient, movement requires less effort. And when movement requires less effort, people move more. That quiet upward cycle. Better breathing leading to more movement, leading to better overall strength and confidence, is the real long-term gift of this practice. This is what Senior Health Advice exists to give you: the science that standard appointments run out of time to deliver, explained clearly, and built around what your body actually needs. If this video has given you something useful today, please share it with someone over 70 in your life who is dealing with shortness of breath or that heavy morning chest feeling. Subscribe to Senior Health Advice so you never miss what comes next. And leave a comment below telling Dr. Natalie Brooks which of these techniques you are going to start with tomorrow morning. Your lungs are not finished. They have simply been waiting for the right signal. Give them exactly what they need and watch what happens.